to tackle the subject of should the United States have free healthcare? So the problem I ran into with this is the more I thought about it, the harder it kind of seemed, because don't we already have free healthcare with the ACA passed in 2010? And we also have programs like Public Health, WIC, and there are free clinics floating around. So we already do have free healthcare in my mind, but I did a little research. Public Health and WIC programs, as many of you may know, are funded by state dollars, your state taxes. Free clinics are kind of popular and new to the medical industry. They've been around since 1960, and they are usually funded privately, and they rely on doctors to volunteer their time and services. We also have Medicaid, which is free health care insurance for seniors and disabled. So don't we already have free health care? Fact of the matter is, the United States has been trying to pass a national health care insurance or a universal health care system since President Roosevelt was in office. And Medicare and Medicaid were enacted in 1965. President Clinton passed a program called CHIP, which is an extension of the Medicaid program, which covers children of the low-income families. And President Obama just barely passed the ACA program in 2010. So let's look at the pros of our free health care or the ACA program that we currently have. The pros is the ACA is supposed to make healthcare free or available to everyone. And it's also supposed to reduce pricing. By that, the government can step in and tell everybody you're going to charge your patients, say $1,000 for an MRI. So you won't be going to your local clinic and getting charged $1,000 and getting sent to a specialist and getting an MRI done for $2,000 or $3,000. It'll be one flat fee. So that's going to reduce costs across the board, all the way around. And the third thing is, universal healthcare does work. It's been working in Germany and in places like Switzerland and Canada for years. And they should really serve as a role model as to what we should be looking at and possibly changing, and what might not have worked for them. Now let's cover a few cons. The biggest one is always cost. People are going to freak out about the cost, because people seem to forget that with research, technology, and just your people who are hiding behind the scenes, who are buying the supplies for the facility and that kind of stuff, everybody has to get paid. And the Americans want the best of the best, yet they seem to forget there's a price tag attached to it. Fact of the matter is, residents in Germany get 10% taken out of their paycheck, and the employers match that 10%, and it goes to the healthcare program. And in Sweden, your federal tax rate is 53%. Of that 53, 9% is going to the healthcare program. So it's technically not free. You're paying your tax dollars towards it. Fear number 2 is the fact that services or competition might be decreased. There's a fear that why would a doctor want to keep continuing education or go on to school to be a specialist like a cardiologist? I don't really see that happening. And the third biggest con you always hear about is the long wait times. The fear is everybody who didn't have health care before is now going to be flooding in and getting all their checkups and everything else done under the sun, making the critically ill people wait. I don't see that one happening either, because being a good nurse and going into urgent care clinics, I've seen people get ruined by the fact of what they're there to be seen for. I may be in there with the sniffles, but somebody else may have major issues that came in after me, and they're getting ruined before me. But I know better, so I'm not going to complain. So, ethically, yes, everybody should have free health care or access to health care. Fact of the matter is, you should be able to receive yearly checkups, immunizations, and preventative screenings. We all seem to forget that diseases like cancer, their chemotherapy, some of the drugs they have to take, that increases the cost of health care. If everybody was receiving a preventative screening, we'd catch things sooner and we wouldn't have to go that extensive route of chemo and some of the other way out there cures that we have to deal with. So truthfully, yes, we should have free health care and it should be available to all. But fact of the matter is, nothing is free.